Good morning, Chodesh Tov, and thank you so much for joining us for Spirit, the stimulating program initiative for retirees that inspires thought. I'm Judy Steinig, Director of Community Programs for the Orthodox Union, and it's my honor to coordinate and host this program. The OU started Spirit several years ago as an on-site program, and now we're happy to present it as an online program for empty nesters, retirees, not yet retirees, baby boomers, sandwich generation parents, and seniors. Everyone who is looking for educational, intellectual, and spiritual growth. Now, during the pandemic, as we all continue to shelter in, even if we've had the vaccine, Spirit has become the perfect way for each one of us to engage in a virtual setting. Today's program is going to deal with Medicare, a topic that we hear so much about and certainly need to understand. Many viewers are probably already on Medicare, but yet you still need to know about important updates that you're going to receive today. Others are still contemplating and knowing that they will be registering for Medicare, and they certainly need to know everything that's important to understand before they apply for benefits. Our presenter, Shmuel Zaidman, is a licensed health insurance specialist who has spent the past 14 years working one-on-one, educating and enrolling Americans entering Medicare. We are so honored to welcome him and appreciate his time in explaining everything that we need to know. It is my honor to turn the Spirit Forum over to Shmuel Zaidman. Thank you, everyone, for joining us.
Thank you so much, Rebbitzin. My name is Shmuel Zaidman, and I am a health insurance specialist. For the past 14 years, I've been working with individuals who are entering Medicare and do need to seek out professional advice. It is very important to seek out professional advice so you avoid any penalties and that you do not overpay or that you're undercovered for your health and your medical care. So I'm going to take the next 30 or so minutes and run through Medicare, and we'll mention also some details related to long-term care insurance and long-term care in the whole category and understanding what long-term care is as well. So I'm going to change my screen and pick up some slides. Excuse me. Okay, there we go. So most of us do not actually know what Medicare is until one of our parents asks us for help or we are turning 65. Many of us turning 65 don't actually even know anything about Medicare until our human resource manager and the company we work for shares something related to Medicare with us. So what is Medicare? Medicare is health insurance. When does someone find out about Medicare? Usually when they're approaching 65 years old. So as you can see on the screen, most of us receive a pile of mail. We might receive a publication from Medicare directly called Medicare and You, and other publications trying to explain to us it's time to pay attention. We'll receive telemarketing phone calls, and honestly, it's very, very confusing. So what is Medicare? Medicare is a federal program started many years ago in 1965, 1966. And it is run by CMS. CMS stands for the Centers for Medicare and Medicaid Services. So when someone says, what is Medicare? Medicare is health insurance. Who runs it? The federal government. As you can see on the screen, there's a picture of a Social Security card, which we all have seen before, and the red, white, and blue Medicare card, which is actually a health insurance card saying that you have Medicare. So what is Social Security and Medicare? They are not connected, meaning you can have one without the other. So Social Security is your income for retirement, and there are important ideas to discuss when to take it, and why to take it, and how much you should be expecting to be receiving. The amounts are unique to each person, so we'll save that for after the Medicare conversation. So what is Medicare? Do I need Medicare? What does Medicare cover? Is Medicare all that I need, or do I have another insurance? We're going to go through that with the slides right now. So Medicare covers for what all health insurance covers for: hospital and outside the hospital, also known as outpatient. They call that Part A and they call it Part B. So Part A covers for hospital with a small deductible, and it only covers for a certain amount of time. In other words, someone cannot just stay in the hospital for 6 months and expect to pay nothing. They will have to pay at some point a certain amount of money per day. And the time that Medicare gives someone in the hospital does not last forever. And so at some point, that benefit period or time runs out, and then you dip into lifetime days. So in other words, it does cover for hospital, but it just doesn't last forever. Then there is Part B. Part B, oh, let's see, where's my Part B slide? One moment. Here we go. Then there is Part B. Part B is for the doctor and the outpatient, and it costs every single month $148 starting this year. There's a small deductible, rather insignificant, $203, and Medicare only pays 80%. So when someone says, what insurance do you have? And you say, I have Medicare, that means for hospital and outside the hospital, but there are some areas that are not fully paid for. For example, they only pay 80% and they don't pay the entire bill for the hospital. Now, people want to know, if it's health insurance, is it like my current health insurance? Meaning, does it just cover me in the state that I live in? If I live in New York or New Jersey, does it cover me just over there? And the answer is that 94% approximately of the doctors that you will see for the rest of your life, they know you're coming in with your Medicare card. And so it covers for the majority, overwhelming majority of facilities and physicians that you'll be seeing. Now, somebody would like to know, okay, I'm still working. Do I need Medicare? In other words, I have insurance. Do I need a second insurance? And the answer is that if a company has fewer than 20 employees, then Medicare is your primary insurance and you must enroll. If you do not enroll, you will receive a penalty. But more importantly than that, if you do not enroll and there's a medical expense, you'll end up receiving a letter from your group health insurance after they paid the bill. And it will say, hey, weren't you 65 when we paid that bill? We would like our money back. So it's very important to know when you turn 65, if you're supposed to be on Medicare, because that's your primary insurance. If you work for a large company, although you're not forced and it is voluntary, you can stay on the group insurance. Should you? Is it worthwhile? Is it affordable? Does it have good coverage? Those are questions we answer for people. But even if it was free, but it has a high deductible, there's lots of co-pays, the coverage area is limited. Some people's health insurance for their group is not free. It might cost you $500 or $1,000 a month. And Medicare comparatively would be a lot less and give you more for your money. So even if you're working and you're working for a larger company, you might not necessarily benefit by being on the group health insurance. Okay, so if you'd like to find out if you should stay in your group health insurance, you might want to write down these couple questions. Is the deductible higher? Do I have limited coverage and benefits? If yes, then maybe Medicare would be a better value for you. And that's something we can answer, of course, if you have any questions about that. Okay, so again, it's the rule of 20. If the company has more than 20 employees, you could stay there. Again, if it's not a good coverage, you don't have to, but you can stay there. And it's called the rule of 20. So Medicare doesn't pay all of your expenses. So who does pay the remaining amount? So there are two different types of coverage. We call one the apple and one the orange. The apple is always the one that people would like to have. That is Medicare combined with a supplement and a drug plan. Combined, all those three together will give you the best coverage that money can buy. It's not expensive, and overall it's around $300 a month total. And all you do is you pay your copay for your prescription drugs. On the other hand, you can also have the Medicare Advantage plan, which is an HMO. Not necessarily recommended, but it still works nonetheless. There's generally no premium, so you end up paying just for your Medicare Part B, which is about $148. It includes a drug plan, and although there is an out-of-pocket maximum, you pay a copay for just about every item, and you must stay within the network. So if you can afford it, the package, we'll say, of Medicare plus a supplement and a drug plan is the most ideal. People would like to know, well, if I pick up what's called a Medicare supplement, I hear a lot about the different plan letters. There's a plan letter F and a plan letter G and a plan letter N. Those are the most popular. Honestly, they all perform the same function. The only difference is N has a few copays, G does not have any, and either does F. You cannot purchase F if you just turned 65 after the 1st of January 2020. So some of your friends might say, I have plan F or plan G or plan N. Whichever plan you have, you will be happy. We just place you with the one that you can afford. You can go see any doctor, go anywhere in the country to receive services, and for the most part, you'll have little to no out-of-pocket costs. So when someone sees an advertisement for a Medicare supplement plan, as long as they have the same letter in their discussion, they're talking about F, they're talking about G, talking about N, you will be talking with the other person, understanding that you're talking about the same thing. It doesn't matter which company. For example, if it's Empire Blue Cross, is the same plan G benefits as with Aetna or United Healthcare or any of the other companies. So as long as you can agree on which letter you're talking about, you'll always be able to communicate with the other person and understand. If you just say, I have a supplement, you might have an N, other person has an F. You need to know that you have slightly different benefits, but for the most part, you're fully covered. So whichever one you have, it will work well for you. Now, it gets a little more complicated when it comes to prescription drugs. In every county, there's about 30 different plans. And there are 8 major companies to choose from. So what that means is you might just take a blood pressure pill or a diabetes pill, and you would like to know which one of these 30 plans is the one for you. Now, you might say, I love Blue Cross, or I love United Healthcare, or I heard WellCare or CVS is good, or Walgreens. But at the end of the day, each plan charges a different amount for your prescriptions. So your drugs might be free on one plan and $100 a month on another. So what we do is we run your prescriptions through the Medicare.gov prescription drug plan finder, and it will list all the plans for us from number 1 all the way down to the last plan. The last plan is generally very expensive, and the first plan is usually the least expensive. So what we do is we'll probably place you with one of the first 3 plans to get you the best value for your money. You can actually do it yourself on the Medicare.gov website. It doesn't necessarily mean that you'll understand all of their matrix and the money aspect of it on their report. But if you want to run your medications on Medicare.gov, you'll also see those same 30 plans, and you can sort them from the least expensive to the most expensive to find a plan, or to at least focus on a plan to speak to someone about it. Here is an example of what it might show you on the screen. You'll enter that you take a few medications, and it will tell you if you use plan number 1 and you go to a particular pharmacy. On the screen it says CVS and Walgreens. You can see it's $300 more to fill those prescriptions on that plan at CVS above Walgreens. And on the right side of the screen, you'll see plan number 2 on a different plan with the same medications. You might pay an enormous amount of money, quite a few $1,000s more. So most likely the plan on the right is closer to the last plan on the list, number 30. And the plan on the left of the screen is most likely one of the first 1, 2, or 3 options, getting it down to the lowest possible cost. So we understand these numbers, and the reports are not necessarily easy to understand. And so we help people to figure out what they're trying to tell you and which plan is most likely the best value for you. Now, everybody knows Joe Namath, so you'll probably recognize this picture. But I just wanted to end off to explain one thing. The pile of mail that you receive, most of it is it's not written in a way that I would consider ethical or honest. It tells you, enroll in our plan, enroll in our plan. I need you to know that most of those flyers belong in the garbage can. And the reason is because the Medicare Advantage plans, they send out beautiful flyers, but you need to know it's not original Medicare, meaning when someone says, what insurance do you have? You cannot answer Medicare anymore. You must answer that you have Aetna, United Healthcare, WellCare, Blue Cross Blue Shield. That is now your health insurance. In other words, Medicare has taken a seat in the back, and the driver is the Medicare Advantage plan. And what that means is if a doctor does not take your Medicare Advantage plan, or a hospital, or a treatment facility, a rehab, you really can't go there. And we receive a phone call in our office, most likely 2 to 3 times a week. And the phone call generally discusses someone who needs care, but they cannot enter a facility or receive care because they have a Medicare Advantage plan. And so, however well they work, there are restrictions, and generally they come around when someone needs acute care. So as well as it works, the best option is, of course, having traditional Medicare and a supplement. But if you are in a Medicare Advantage plan, at some point, you might have to leave, and we do assist people with that and return them to traditional Medicare and then place them in a supplement, which might be many years down the road from now, or it can happen right away. Since we don't know our future medically, it's best to take the plan that works best for you. And we can explain what plan might work best for someone based on their current health and finances. Okay, lastly, related to Medicare, not everybody pays $148 a month. Some of us are quite fortunate and we have a higher income. And because of that, you'll see here on this chart, if someone does have a higher income, on the right side of the screen, they will pay a slight bit more, or if they do very well as a couple or individual, they could end up paying not $148, but as high as $500 a month for their Medicare Part B premium. So for example, if someone does make quite a bit of money and they decide they'd like to leave the group, or maybe they just want to retire, and they thought they were going to pay $148 a month, they will receive a letter from Social Security saying that the past 2 tax filings show they make $100,000, $200,000, some higher number, and they are going to pay more money for their Medicare Part B premium. You can find that out. It's not a secret before you apply, and we can tell you how. Now, it doesn't just apply to the Part D. It also applies to Part B, to your medical coverage. It applies to the Part D as well, which is your prescription drug. So for example, if someone makes more than $88,000 as a single, or $176,000, or at least they file the past 2 years making on average that amount, they will receive an additional penalty on top of their drug cost. So for example, if they enrolled in a drug plan that costs $20 a month, and they made $138,000 or $200,000 over the past couple of years, they will receive a letter that says, we're going to add $12.30 or $31.80 to your monthly premium for your drug plan. It doesn't mean that you shouldn't get the drug plan, and you should feel blessed that you could afford to pay that $31 or $12, because many people by that age are not making that income. So as bad as it might sound, I would still consider it a blessing and take it in stride. And as you file your future tax years, if your average income goes down, then your penalty will slowly go away as well. So for example, if someone sold a home and one year they made money on that home, then unfortunately the average tax year for the past couple of years will show that you made more money. But that will go away once you file the next 1 or 2 tax years, so not to worry. Okay, I'm going to take just another minute to talk about long-term care and what that is. Just going to share the next slide. One moment. Let's see if I can figure this out. Here we go. Okay. Let's make sure I'm sharing the right screen. Okay. If everybody could see this screen, I will begin with this. Long-term care. What is long-term care? Long-term care.
It's not, I'm not seeing it yet.
Okay. Can you see that? No. Okay. No problem. I'm going to.
Can you just press share again?
Exactly. There we go. Thank you so much. I will press that. Share screen. Found it. Excellent. Thank you so much for letting me know.
Okay.
Okay. There we go. All right. So what is long-term care? Long-term care means that not by choices that we've made on our own, but just the way things have turned out. Someone might have had a stroke or maybe fell ill, and they can no longer perform 2 of the 6 necessary activities that we all need to perform every day: eating, bathing, dressing, getting in and out of our bed, using the bathroom, and walking or being mobile, our mobility. So what does that mean? That means that Tati or Mommy, or maybe one day ourselves, many years into the future, will need to live with someone, pay an aide, a nurse, or maybe have to be in a facility where they could work with that particular condition. So what does that mean? I tell people that, we don't know to expect it, so it's best to prepare. But when it does happen, these are the consequences. Generally, there is a need for the family to get involved, help make decisions. And usually the spouse or one of our children will take the role of what's called a caregiver. And that means that they didn't have a choice. The situation just one day came upon us, and we want to help. We want to be there for our family, but one of us becomes a caregiver. We all want to stay at home, but not everybody can stay at home. And we might have to go to what's called a long-term care facility. It's basically like a nursing facility that deals with someone with that particular illness or medical care that's required in that situation. Retirement savings, meaning that is the money that will be used to pay for that aide at home or that nurse or for that facility. Now let's find out what Medicare can do in this case. But I would like to say that about 50% of our children will end up taking care of us. We'll live with them, or they will take us to a facility every day, like a daycare, or spend part of the day with us at a facility. And so we need to know the impact that it has on our children. So we try to make decisions that we know will affect them, hopefully way into our future. Now, again, you don't have to be in a nursing facility when someone needs long-term care. We can be at home or be driven by either a specialty service or on our by our families on our own to a daycare center. But most of us will be in our home receiving care. So that is not covered by Medicare. You'll have to end up paying for that. And so it's important to plan on how you'll be paying for that from where. Many people have what's called a long-term care plan. And that means that you'll have the money to pay for the services. But what happens if you do not have that plan? Then your family member will end up taking care. They will have to cut their job out of the picture. Maybe they will work part-time or just quit totally. And they might not be able to handle, someone might be a little bit heavier or larger, and they can't be moved around by the family member. And if it comes to other important and personal areas like bathing or using the bathroom, some of us might not be able to handle that. So eventually we will have to pay for a service of some sort. So it's important to consider how that can be paid for. Okay, and that is the slides on long-term care. Let's get back to the regular screen. One moment. There we go. Okay. There we go. Okay, I had a slide on Medicaid, but I don't see it on the screen, so I'll just talk about that briefly. Medicaid does not pay for all of our care, and most of us will not qualify for Medicaid just one day waking up and saying, I want Medicaid. Because Medicaid requires us to have basically no money and very little assets. And although we do seek guidance from an attorney to move around those assets, what would happen if one of us needed long-term care before we took care of that? Or that the look-back period, which is about 5 years, to move around your assets and money into a pool or given away towards your family, what happens if we didn't have that time? It just, just came up upon us. So we will have to end up spending down our money until we can qualify for Medicaid. In other words, Medicaid can be applied for, but it takes some time, and we will have to exhaust most of our resources if we have not yet arranged for the movement of those in some type of a legal trust for our children. If somebody has any questions related to how to enroll in Medicare or any of the subjects we discussed today, we have that actually on our website, which was shared, and it's a very easy to remember website. And of course, you can reach out to myself if you have any questions. The website is 65 and ready. Very appropriate, because that's what happens at 65. We need to know if we're ready, and we need to get ourselves ready. Rebbitzin, if you would like to share any questions, I'd be more than happy to answer any questions.
Sure. First of all, thank you so much for that presentation. I think you made it very, very clear. I wouldn't say that you made it simple, because it's not simple at all, but I think it was made a lot of clarifications, and we definitely appreciate it. Okay, so there are a few questions, and I want to welcome anybody else to put a question into the chat, which will ultimately come to me, and we will deal with as many as we can. Okay, so the first one is, do you need to show Medicare that your income went down each year? I assume so that they will lower it. Or basically, how do you show Medicare? I think it's probably clearer.
Okay, so, well, first of all, I'd just like to say that no matter what someone's financial situation is, Medicare does not have a test to see if you qualify. In other words, someone can be rich and they can be poor, and at 65, they could still be on Medicare. However, if they are receiving what's called a income-related penalty, which I believe is the basis for this question, every time you file taxes with the IRS, it's shared with Social Security. the past two filings are used. So if 2 years ago, you say you made 200,000, and then again, 1 year ago, 200,000, then they say your average income is 200,000. If 1 year was 100,000 and one was 50, then most likely they look as if you made $75,000. So if you file taxes this year, March the 1st, they will now use this year's and last year's on average to average what your income is and determine if you should have a penalty, meaning an income related penalty, or if you had a penalty and it's going to be removed.
Okay. In general, non-Medicare health insurances, most have a maximum out-of-pocket expense, which certainly is helpful, even though that's high. What is the policy on Medicare? At a certain point, do you max out and they say they take care of the rest, or how does
Okay,
that work?
that's actually a fantastic question. And whoever asked that question, thank you so much. I think it'll be very helpful to a lot of people. Medicare has unlimited liability. That means you have unlimited liability. Medicare does not have a max amount of pocket. So say, for example, Medicare is paying 80% and the procedure cost $100,000. So $100,000, technically 20% of that is $20,000. With your group health insurance or private plan, there is a $6,000, $7,000, $8,000, $9,000, $10,000 out-of-pocket limit. So if someone has a supplement, it takes care of your out-of-pocket costs. In other words, you do not have to worry. But if you're on a group health plan, there is a limit, that $5,000, $6,000, $7,000, $8,000, $9,000, $10,000, and that's when your insurance with your group will say you no longer have to spend any more money. But with Medicare, it's unlimited. There is no out-of-pocket limit, but if you have a supplement, they take care of that. And on a Medicare HMO, a Medicare Advantage plan, they have a limit too, $5,000, $6,000, $7,000, $8,000, $9,000. And at that point, they say as well, we no longer need you to spend any money. We will take care of the rest.
Okay, I think that's reassuring. Okay, regarding long-term care, a lot of people, don't even think about it, when they're younger, when it would be less expensive because there's tons of other things. Is 65 still a time that people can actually qualify and get long-term care? I know there's lots of qualifications and things like that.
Sure.
How does that work?
Okay, that's a fantastic question. I'd like to answer it. There's three different important points. Number one, you can purchase it technically till you're about 80 years old. Now, the rate will be quite a bit, meaning at 50, it's less than at 60, which is less than at 65. But if somebody wanted to purchase it at 65 or 70, that's perfectly fine. The second point I'd like to make is a person's health is very important when it comes to long-term care. They are not interested. The insurance companies are totally not going to give a policy to an ill person. Now, we all live somewhat in denial, meaning we stub our toe, we say we're okay. We have a particular illness or medical condition, we say we're okay. But the long-term care insurance company, the carriers, they actually say, oh, you have Alzheimer's, you have diabetes, you have high blood pressure or gout, or you were hospitalized 3 times in the past couple years. Most likely they will not accept your application at all, meaning that door has closed and you are not going to be able to purchase. So we recommend, we have a sheet, it's a 1-page sheet, and it has health questions, meaning, have you been hospitalized? Do you have any one of these conditions? There's like 20 conditions on there. If you would like to receive that that paper, that form, and you can give it to us, and we will help you to understand if you still could be approved for long-term care, just let us know. But it's very important to know that it gets expensive, more expensive as you get older. You must be moderately to in good health. And at some point, there are conditions that they will totally not consider giving you a policy at all.
Are there any other suggestions you have if someone doesn't qualify, or just start saving?
Yes. So, many of the people listening today have worked. They've worked hard all their life, and they probably saved up. They have an IRA, a 401k, they have money in the stock market. You could actually transfer money from IRAs and 401ks without penalty and tax liability into a long-term care policy in one lump sum, 50,000, 100,000, a couple hundred, a few hundred thousand. And this way, you're not, you will not receive the same scrutiny as a regular applicant will, because you're putting all the money in now, and the policy will give you more than you put in. And so there are still options, but for the most part, we advise people to try to find out today if they still qualify, and this way they know they have options. Say they do not qualify, you should contact an attorney. If you need us to recommend one, we can recommend one, who will do what's called retirement planning, and they will put your money into a pool or a trust. So this way, if the day does come, you will be looked upon as if you are impoverished, and you will be approved for Medicaid.
Okay. Any comments about, has COVID with Medicare benefits, or have there been any changes or anything that people should know about, in the past year? Have anything happened?
Okay, so COVID is on all our minds, and some of us have had it and have already been hospitalized, and Baruch Hashem have come home, and many of us have not and are doing very well. But what are the changes? And those are very important to know. Medicare has waived many of the expenses or copays or co-insurance related to Corona, because the federal government is giving extra money to the hospitals and facilities to take care of us. So I don't think it's anything that we should be writing down, meaning there's nothing particular that you need to be careful for or be aware of, but you should just know that there has been some changes, and it's best to just try to be fully covered for, let's say, with a Medicare supplement and your Medicare together, so you do not need to worry about any of those additional expenses that might come up.
Okay. I'm not seeing anything else. Anybody else have anything that I haven't noticed yet? Doesn't look like it. Okay. In that case, of course, you'll be receiving the recording later on today with the, oh wait, 1 second, something just came in. If your current income is drastically lower than one's 2 prior years' income, will Medicare consider reducing the penalty calculated on the 2 prior years' filings?
Okay.
Maybe retroactively or something.
Okay, so the answer is this. Say, let's see, it's we're filing now for 2020. So that means 2018 and 2019 have been filed. And it shows that your average income was high enough to receive a income-related penalty. Just because in 2020 you didn't make a lot of money is meaningless to Social Security and the federal government. The moment you file 2020, that's when it becomes meaningful. So if in 2020 you file that you made 0 money, they'll average that with 2019. And that is the amount of money that they will use. And if that amount of money is not deserving of a penalty, then that penalty will go away. If you file in January, it will go away right away. If you file in September with an extension, it won't go away until September. So if you've made drastically lower amounts of money in 2020, we advise you to not postpone filing taxes, but to do it as soon as possible.
Got it. Okay, anything else? Not seeing anything at this moment.
I would like to say one more thing. Oh, good?
Yeah, 100%, yes.
Okay. And that is, Medicare is a very comprehensive subject. In other words, nobody could really know all about the combination of Medicare, Social Security, group health insurance, how they all connect, and when to make a move when. And remembering all of the details of today, I think for the average person is nearly impossible. So what's most important is don't be afraid to ask. That's what people do. They call us and they say, I know you're going to give me good advice. I'd like to ask a question. It doesn't mean you're doing anything. It doesn't mean you're making any changes. But if you are ignoring the fact that you might need advice, there's a good likelihood that it might cost you in the future. And so we recommend to know as much as you can and to ask as much as you can.
Okay. As we had said before, everyone will receive the recording later. That recording will have Shmuel's contact info, of course, his website, so that you can connect with him personally if you have other questions. We want to thank him so much, really, for making things so much more clear. You know, obviously we will all have a lot of personal questions, which would be not in the bounds of this presentation anyway. So thank you so much, Shmuel. We really appreciate everything. In the future, as more items come up or changes take place, we have no idea what's going to be. I'm sure we didn't get to that because we just don't know. You'll let us know and perhaps come back for an update at some point. Thank you so much.
I appreciate that. You're welcome.
Okay. So I just want to remind everybody that with the today's recording, of course, you will get the registrations for next week, which will be Tuesday. Bonnie Giller, who was with us, oh my gosh, in May, I think, will come back. She's a nutritionist to talk about how to break free of dieting and trust yourself with food, issues that we all deal with. And Toby Weiss, who works at MJHS, will be discussing on Thursday accessing healthcare resources when facing serious illness. It could be something for ourselves, God forbid, or for a loved one. So that will be Tuesday and Thursday. So you'll be seeing that in the recording, you know, when you get the recording today. I want to thank, again, of course, thank Shmuel Zaidman so much for joining us today, and thank all of you. Everyone be healthy, be safe, Chodesh Tov. Let us hope that Adar will summon in a lot of joy and happiness, which I think we always need, and in particular, we need it now. Take care, everyone. Have a great week and have a good Shabbos.